Racial Justice Incubator. And AAJIL, for short, at its core offers general racial justice education that specifically employs a decolonial framework and that intentionally integrates Asian American Pacific Islander histories and experiences within general racial justice education. And radiating from that core work, we aspire to practice mutual care through community building, opportunities for collaboration and innovation, and also hopefully the long-range potential of people to impact their spheres of influence. So that's what we do. You can follow us on Instagram at AAJIL, AAJIL_org.
Thank you so much. And our next panelist is Emilio, Feliz, Sala. Emilio, could you tell everyone a little bit about yourself?
Of course. Hey, everybody. My name is Emilio Feliz. As was mentioned, I am an MD and PhD student at Keck School of Medicine at USC. Born in the Dominican Republic, I came here when I was 7 years old, so I do have ties with the immigrant experience. I moved over here 4 years ago to Los Angeles for school. And I've been taking a year off from medicine to study public health right now. I'm working on my public health degree. And it's been very interesting to see how the COVID-19 pandemic has influenced a lot of the spheres in public health. So as a student, I'm like learning every day. So feels nice to be surrounded by panelists who are so experienced in their work. So thank you.
Thank you, Emilio. Next, our fourth panelist is Dr. Carmen Holmes. Mind telling us a little bit about yourself?
Hi, yes. Again, I practice internal medicine and pediatrics, specifically doing urgent care. I lost my passion for medicine years ago. The system is broken, and it's not just patients who are harmed by our system, it's physicians too. And, you know, we see all of the deficits of the system, and it's hard on us as well. The way I channel my passion now is for physicians and physician well-being. And what I hope to be able to share today is how important the relationship is between patient and doctor or provider. It's that core of medicine that I think is really lacking, and it's lacking for all communities. So I'm really happy to be here.
We're happy to have you. Thank you so much. And our last panelist number 5, Patrice Peck. Patrice, you mind telling us a little bit about yourself?
Hey everyone, I'm Patrice Peck. I'm a journalist based in Brooklyn, but sheltering in place in Los Angeles. My work covers so many different beats, but the common thread is intersectional representation, diversity, and personal stories that are historically and traditionally undercovered and underreported on by predominantly and historically white publications. I recently, earlier this month, launched a newsletter called Coronavirus News for Black Folks. And that's because I knew, just having followed the news, that people of communities of color, but particularly Black communities, would be disproportionately impacted by COVID-19 and the pandemic because of the pre-existing medical conditions that often come within that community because of systemic racism and just other factors also. So that newsletter has been great. It's just been a way of empowering and keeping Black people informed about the disease and pandemic.
Thank you so much. Yes, that's super important. That's another thing we're going to look at as well. How do we get information out to people and the problems systemically that happens that keep us from doing so, that then in turn harms communities. So thank you so much for your work, Patrice. So let's get started. My first question is for Emilio. I know that you're studying public health, and right now we kind of wanted to see what COVID-19 has put us in, the situation that has put us in with different communities. And with your work and what you've been doing this year, especially being a med student at this time, what have you been noticing has been affecting communities?
Well, communities specifically, so We have, it's been very recent, unfortunately, but we have been getting in the news, getting information about how the COVID-19 pandemic has been affecting communities of color disproportionately, especially Latinx and Black American communities. In terms of just some numbers, like 20 out of 31 states reporting reporting data on COVID-19 cases and death rates. A high disproportion of those percentages of cases have been from Black American communities and Latino communities, Latinx, especially in New York City. New York City, the epicenter of the disease, has been very hit drastically, and so like the question is why are we being so disproportionately affected? And as from a public health perspective, you can think of from my medical perspective, we think of, like, as Patrice was mentioning, pre-existing conditions that exist within communities of color, and especially in the Latinx communities. These include like diabetes, cardiovascular disease, hypertension, Black American communities, and so these are the same diseases that the guidelines from the federal government have been saying increase or the risk of individuals suffering from severe complications of the pandemic. So already these communities are at a disadvantage just by facing the pandemic in the first place. Other factors, health access coverage. 1/3 of the Latinx community that lives in the United States is non-citizen. Historically, non-citizens have been underinsured or have very difficulty accessing health insurance in general. And so that's without a COVID-19 pandemic. Imagine now you have no insurance, you're at your house, you get sick, you start getting some of these symptoms, and then where do you go? You feel the need to stay at home because you just don't have the right coverage, and then you put yourself at risk of developing more severe symptoms, and then if you live with others, you also put yourself at risk. Another thing that I wanted to say was like language barriers, especially in the Latinx communities, and even more so in the immigrant Latinx communities. A lot of the information being disseminated from the federal government is in English. And even when that information is in Spanish, it sort of assumes that these communities have access to internet and have the ability to gain that information. And then even when it assumes that it has that those communities have access to internet, it assumes that the information is being conveyed at a literacy level that's understood by all of them. And so that complicates things because that's not always the case. People in different communities have different literacy rates. And so just understanding the information and being able to actually put it to your daily life has made these communities very vulnerable. And there's more, but for the sake of time, I could just pass the mic. But yeah, if anybody has questions on those, I'll be happy to answer.
Yeah, thank you. Thank you, Emilio. And I mean, for the sake, we could go on for this panel. I mean, there's so many things that you get into once you start breaking down and seeing specifically which communities and how it's affecting certain communities. I know it's different for each one, but each is important because we're all dealing with this. Mm-hmm. I actually have a question for Patrice. With your coronavirus news for Black folks, I know you've been talking to a lot of Black people about their experiences and and how they've been affected by COVID. Do you mind sharing some of the stories and some of the people that you talk about that has resonated with you the most?
Sure. Recently launched an interview series called Essential and Black to spotlight Black essential workers. In the media and lots of outlets in the media, we've been seeing a lot of like doctors and nurses who are obviously very critical and, important right now in terms of being on the front line and fighting this disease and pandemic. But as we all know, there are essential workers are predominantly people, brown and Black people, to be honest, and a lot of times we're working in the jobs that have low wages and little to no benefits. You know, if we're thinking about the people that are keeping the hospitals clean, particularly a large number of healthcare aides. I like how Jesse brought up the language barrier, because there's also, you know, hospital interpreters and, you know, the people who need to make sure that people are understanding, you know, what some of the medical professionals who don't speak their languages are saying. So there's just like a lot of people that have been overlooked, caretakers, the ones, you know, the people in prison, like the incarcerated people. And so, like I said, I started a series called Essential in Black. And so this week we published an interview from a security guard, a 20-something-year-old in Harlem, New York. She's currently working at a homeless prevention center, and she just feels completely betrayed by her employer in terms of the way she's being treated and underpaid and under-resourced compared to her colleagues. And I think she said a line that she was like, the slave conditioning has worked on me. It has frozen my tongue and my heart. So it's just like very devastating things, because we hear the statistics and in terms of the disproportionate impact in cases and deaths among Black and brown communities. However, we don't see what these people look like. You know what I mean? It's hard to empathize with numbers. And I feel like a lot of the people reporting on it, because the media is also very, there's not a lot of representation in a lot of media publications, you don't necessarily have reporters who either feel the need to or have the skill set in order to humanize these stories, right? And one more thing I want to add is this pandemic is revealing a lot of health inequities that have existed for so long, right, within these communities. And that includes racial bias within the healthcare system, within hospitals. And so, you know, I think it was this past Monday, this 30-year-old Brooklyn teacher died after being denied testing twice at a hospital. A Black Detroit woman who worked at this hospital for 31 years was denied testing at the hospital she's worked at 4 times and died. And I've been seeing these stories surfacing at different publications, because in my newsletter, I'm aggregating it, all this news. However, because there's been a drastic decline over the years, just as there has with like all media, but particularly with Black media, there's no place where we can go to find like all of these stories. You have to either be following the news crazy and reading all these different publications, including local publications, because not all the national publications cover all these stories, or you just want to be aware. So I'm just seeing similar stories, but just spread out. And of course, they're all devastating and heartbreaking. And the most frustrating thing is that they're all avoidable. But, you know, here we are.
And thank you for doing the work to get all these resources together, because I think we've all probably experienced some kind of news fatigue coming on and with all this. So thank you so much. And what you're doing is really helpful in getting this out and seeing the disparities. Carrie, did you?
Yeah.
Yep.
Yeah, hopping in, and thank you again for sharing that. Especially, I think representation in media that is accurate and from an authentic source is really important and super underprovided. So along with that, a lot of the things we see are representations on social media and social media conflict and conflict in general. And I've been seeing a lot of things that where essentially different community colors are sort of I'm seeing this in the media that people are sort of being like pitted against each other. So this question is for Jesse and Dr. Sandy Kim. I guess from a social justice standpoint, how is this crisis perhaps either exacerbating conflict between different communities? How can that conflict be bridged? And I guess this will be touched on later, but like, where did that stem from?
I just wanted to name, like, being in this Zoom world is so disorienting, and like so much of it, like so many of us, like this is our work now. Like there is a gang of folks like on this call, and sometimes it feels like you're just like talking into like a void. You know what I mean?
Yeah.
So for like the folks that are tuning in, like if you really feeling like what folks are saying, like Leo, give us the feedback, please. Like hit us with a reaction, like drop something in the chat, like let me know. Like, because sometimes it can be really disorienting. You know what I mean? But yeah, like getting to the question in terms of like the exacerbation of social conflict, like I think we want to like name like what is really happening there. And when we talk about conflict between communities, what we're actually talking about and naming is like white supremacy.
Yep.
When we think about seeing instances of like direct violence, interpersonal violence against folks, and we look historically, like who are the folks that commit like the disproportionate number of hate crimes, like that is white people. So no matter like what we're looking at, whether it's like this interpersonal violence against like Asian Americans, the economic struggles of like Asian businesses, anti-Asian rhetoric, the health disparities amongst like Black and brown folks, indigenous folks, the environmental conditions that have like historically led to us being like at a higher proportion for some of these pre-existing conditions, like all that points back to white supremacy. And I think the media would want you to think otherwise. You know what I mean? Like Patrice was saying, like it's designed in a way for us to have difficulty in accessing like information, right? And we know that most of these major news outlets are run by white supremacist institutions. You know what I mean? And so they would like to have us pointing the finger at each other, but you know, we're not getting the real of what's happening. You know what I mean? So you have 45 on here out here talking about like it's the Asian virus, but it's like they're not looking at Italy, they're not calling it the Italian virus. You know what I mean? So what that comes down to, that's just white supremacy.
Yes, I'm gonna give you feedback, and I'm like, drop that mic, Jesse. You know,
this emoji.
Right. I'm fully agreement and in agreement with everything you're saying. I just want to talk a little bit about capitalism and the role of capitalism in all this and white
Speak
supremacy.
on it.
And I'm going to talk about toilet paper. So stay with me here. I'm going to get to my point, but I am going to talk about toilet paper. Capitalism has conditioned us into a scarcity mindset where there's not enough for everyone. So you have to fight for what you need. And under a pandemic, we're seeing the scarcity mindset magnified. And so the competition for toilet paper is sort of a hilarious yet tragic manifestation of this. And the logic of free market competition encourages an orientation that says, I have to watch out for me and my own, and encourages hoarding of as much wealth and resources as possible. That is capitalism. That's how we got a completely manufactured and avoidable toilet paper shortage that isn't really a shortage. The scarcity is an illusion. There's actually an abundance. I'm moving out of toilet paper now. Now I'm talking about in terms of the world, there is actually an abundance with plenty to go around for all if we would just consider the collective good and be able to function from a place of trust and mutual care. So talking about the conflicts between people of color groups, I see the same kind of scarcity mentality happening where we look at the conflicts arising between different communities of color during this crisis. We've been conditioned to focus on the communities of people who look like us because there's this feeling of competition for resources out there. And recently, W. Kamau Bell, he's a comedian, but he's also very much a social justice activist, in response to repeated accusations that he was betraying the Black community for calling out anti-Asian racism, said, being against racism means being against racism. We do not have to be each other's competition or threat. Like Jesse was saying, white supremacy is what has conditioned us to see it that way. Now, it is absolutely true that there are Asians who have internalized anti-Blackness and that there are Blacks who have internalized anti-Asianness, because white supremacy has been working on us all since the moment we were born. But the answer to that problem is not to hunker down in our factions. You know, there's enough anti-racism to go around for all. There's plenty of love to go around. And it's really the only way forward. In my mind, racism isn't plural, it's singular. Racism is a very sophisticated machine with a complex array of moving parts that work together to produce white supremacy. So if one part malfunctions, the rest of the machine, the sophisticated machine, finds a way to compensate until it can be fixed, right? So what do we need to focus on? We need to focus on destroying the entire machine, not just one part. And that's why we have to work together.
Mm-hmm.
Sorry, you make me want to like go back to grad school. Like,
I know.
learn this.
Racism in the machine. Wow. Wow.
Heated
Yeah.
there.
Yeah,
I got heated.
that's good, Dr. Chi.
Yes.
We do need that quoted.
Yeah.
Luckily we have someone to transcribe and quote. Shout out to Kat.
Oh yes.
Yeah,
Shout out to our transcriber Kat. She's
seriously, give her flowers. She's, oh my God, thank you for this.
accessibility whenever possible, very important. So Kat, thank you so much.
Yes.
So
Thank you for sharing. I'm sorry.
Oh, sorry, go ahead.
No, yeah. We actually do want to direct the conversation to you, Dr. Holmes. Could you tell us some of the ways that physicians have experienced burnout and how this affects the Black and Brown patients differently?
So, big question, thank you. And it really, to me, comes down to what Dr. Chi, this was my college roommate a few years back, what she was saying about relationships. I think what's wrong with healthcare is are the systems in place. It's basically a money-making machine that's lost the emphasis on patient and doctor. That's what every encounter should be about. You know, if I think a patient needs a blood pressure medication, we've tried diet and exercise and addressed stress, I write a prescription, but then they go to the pharmacy and they can't pay for it. And I don't know they can't pay for it, and I want to see them in 3 months, and they haven't taken it because they couldn't afford it. So again, that same encounter can be improved if the physician understands where the patient's coming from and vice versa. So to me, it's a loss of all intimacy and all relationships. You know, it's a healing and a really special relationship if someone can have a primary doctor, someone they trust. It's healing for the patient, and it's the reason we got into medicine. My concern about physician burnout is that, you know, pre-COVID, you know, half of us are burnt out. And if I only owe $160,000 now in debt, down from $250, I'm proud. If I didn't owe that money, I wouldn't be practicing medicine, because it's a bad system. It's bad for patients. You know, even for those who have good insurance, the system is not seamless, does not work well. And, you know, when things go wrong, they look at me as though I'm the one who didn't approve their treatment. It was their insurance. So again, it's broken. And those of us who want to help and care about our patients and want to fix every problem, when we can't do that, it's heartbreaking and we feel powerless. So I worry, you know, what COVID will do. I think there are even more doctors who are going to want to leave medicine. And it's the doctors like me who had faith in the system once. You know, primary doctors are going to leave because, sorry, I'm jumping all over the place, but
no, please.
Now, right now with COVID, everyone knows what emergency medicine doctors are going through and people in hospitals. But the rest of us doctors, our wages are cut, our practices are closing because patients are so afraid to come in. And we, you know, the practices were barely profitable. That a lot of doctors are going to close shop, and that's going to affect Black and Brown communities probably even more. So it's just, it's disheartening. But going back to what Sandra was saying and what Jesse was saying, that if we focus on not just how big the system is and how big the problems are, but our relationships and us working together. I mean, for me, that's my only hope. For burnout, but for healthcare in general.
Yeah, and thank you for, yeah, I mean, it's real. I mean, I don't even know. No, it's so real. It's like, how do we address that? Like trying to get that, and especially with burnout, I'm sure that there has to be some kind of correlation when different communities, whether based on socioeconomic status, how the burnout is affecting the physicians, and how the class aspect of all of that would affect physicians as well. I mean, sure. We all know race and class go hand in hand, and you can kind of escape racial biases in either way. And we usually think about the patient, but we're not really having the physician on the top of our mind, and it's important too, because without that, then then what do we have to fight this disease, or to fight this virus? So thank you so much for talking to us about physicians. And I had a question really quick, or sorry, let me just pull this up. Okay, so kind of touching on where we're at now, and how this is affecting different communities. I had a question kind of backing up to like, how did we get here? How were communities kind of left vulnerable to this? And I talked to Jesse earlier, and Jesse, I was wondering if you could talk to us a little bit about your knowledge of generational trauma and how our healthcare system has kind of left communities of color vulnerable during this this outbreak, but through the lens of generational trauma and with our healthcare system.
Oof, yeah, that's a lot.
I'm dropping the questions.
No, yeah, I feel it. I think in terms of like looking at like generational trauma, I really appreciate like the framework that's been put out by Dr. Joy DeGruy, and looking at her work, the post-traumatic slave syndrome. I think she's done a lot of work in just like analyzing and looking at the experience of like Black Americans and how like trauma is transmitted intergenerationally, like through an interpersonal level, but also like on a genetic level. So like if folks haven't tapped in with her work, like definitely check out post-traumatic slave syndrome. And so she talks about just different ways in which like on an epigenetic level, like our DNA code is shifted and changed by trauma. And so on a generational level, like the next generation, the ability for them to like code DNA effectively is actually shifted and changed. And so that's like on the biological level. But on an interpersonal level, like the impacts of trauma impacts like our family structure. It impacts the way that we move throughout the world. And so I really appreciate her work. And I think there are aspects of that that are like, you can translate over into other communities of color, and looking at traumas of, forced migration or refugee status, things like that, or just immigration in general, and how that can play as a huge trauma for a lot of families, and the type of separations that happen. So I think there's socially different things that come up through that generational trauma, and there are ways that we move throughout the world that are protective factors, right? And so for a lot of communities of color, there's like this general distrust of the government. There is distrust of like police and different institutions. There is this distrust of the medical system, because the reality is like, we know that like all these institutions were set up not to serve us, that they actually disadvantage us. My brother Josh put me on to like the work of Harriet A. Washington, in her book, The Medical Apartheid. She like really just chronicles like all these examples throughout history and the ways in which like the medical system has exploited Black bodies. You know what I mean? They talk about like the Tuskegee experiments, James Marion Sims out of New York, like experimentation on Black women in like the field of gynecology. You got Walter Freeman experimenting in the field of lobotomy on Black folks. Henrietta Lacks, like the list just goes on and on and on, right? And so folks are going to be socialized within their different groups to just be distrustful or look at the information that's coming out with a question mark, like, because the reality is like these systems, like, the system that I'm a part of too, like the mental health system, like from a historical standpoint, has served as a tool to oppress folks of color.
Yeah. And going off of that, I know you mentioned the Tuskegee experiments. Emilio, I know that you have talked to us about the Tuskegee experience. I actually Tuskegee experiment. I don't know why I'm having so much trouble with that. Experiments. I got it. I got it. But also with No Mas Bebes as well, which I also had not heard of. Do you mind giving us a little background on that? And again, going off of Jesse's point of how this kind of builds mistrust in communities of color and how we've seen that kind of come to a fever pitch with COVID-19.
Yeah, of course. So yeah, I gotta agree with a lot of the things that Jesse mentioned. It's unfortunate, but there has been so much countless examples of historical trauma on minority populations that have developed the mistrust. And the Tuskegee experiment is like, it even just it hurts me a little bit being a part of the medical community, and like hearing these stories and listening to what's going on. So that the Tuskegee experiment, and you can give it a quick Google reference of anything if you want more detail too. But it was basically a clinical study that was done on the nature of syphilis, the nature of the natural like progression of untreated syphilis. And so what the government did was that they sort of advertised it as okay, whoever is a part of the study is going to get free health care for their untreated syphilis. And so they gathered, I think about 600 male Black Americans, something like that, a portion of which had syphilis and a portion of which did not. And so what the government did was this study ran for 40 years. And so they just let these people of color just run with the disease. And so the complications of syphilis disease include heart disease, stroke, dementia, nervous system infections, death. It's like atrocities. And they let these people develop the natural progression of that disease until they couldn't anymore. And what's worse, in my opinion, all of this is terrible, but the treatment for syphilis, penicillin, antibiotic, I'm sure the word rings, but this treatment was found in the middle of that experiment or somewhere in time. And even with knowing that it has a positive effect on syphilis, they decided not to administer that anyway, just to see where the disease went, which is terrible. And then like No Mas Bebes is just and Jesse, you touched on it a little bit, but it was in regards with obstetrics and gynecology and immigrant women from the Latinx community coming in during labor to have their children. Essentially, they were sterilized. They had their tubes tied without proper consent, without full consent, and without being aware of exactly the irreversibility of that process. And it's just like, it's out of this world how things like this could happen. And we were touching on the fact that over time, the publicization of these like atrocities against the minority communities make just develop this environment of distrust against medical communities. And so like Jesse was mentioning, it puts a question mark on all the information that's coming out, especially, so we have this information now coming out about social distancing, about all these things to avoid, all the symptoms, what to do, coming from a source, which is the federal government, which is not a trusted source of information for many communities. And so that leaves people from Latinx, Black American communities very vulnerable to going about this. And it's crazy because I've heard some anecdotal examples of like people blaming communities of color for not taking COVID-19 seriously, when that's victim blaming. And people forget to understand that there are structural things like these years and years of racial discrimination from the medical community that lead to mistrust and lead to just barriers in communication between the medical profession and communities of color.
Yeah, and I had that's the first time I'm hearing it like that, like victim blaming.
Yeah.
It's this is a product of so much more than just seeing COVID and then being flippant about it. This is generations and generations of proof of mistrust of your own community. So then when something like this comes along, and when like publications are mostly just in English, just for the masses to consume, that's also, it's like, well, this isn't even for me. And I'm assuming that compounds as well.
Right.
So
I just wanted to add on to what Emilio was saying, like this perception that like communities of color like are not taking this seriously. That's all just fictional. Like I'm not, like all that is just white supremacist rhetoric. I mean, I've seen in March, the Pew Center even actually put out some research that they did, like data collection to show that disproportionately like Black and brown people were expressing like a higher level of concern and actually taking this situation much more seriously in comparison to like their white counterparts. So it's like the data is there, but it's like, that's the narrative that we're given, is that like this is happening to Black and brown folks because like we're not taking this situation seriously.
Yeah, that's right. Thank you, Jesse, and thank you, Patrice, for highlighting that. my next question is for Patrice, because we're talking about data, because we're talking about information and mistrust of the healthcare system as well as the media. I wanted to ask if you could talk a little bit more about the importance of news for specific companies by those communities, and the importance of elevating that news into what I hesitate to call the mainstream, but the I guess the mainstream news outlets. Why is it necessary that these news pieces for marginalized communities are highlighted, and how has this lack of news for Black, Asian, Latinx, Indigenous communities, how has that hurt us? Yeah.
Okay. That was a lot. Okay, so just, what was the first question?
Basically, there is a lack of news access, particularly communities of color. Could you explain how that hurts us specifically, and how that's sort of come to be?
Yeah, so for example, the one of the key ways in, staying healthy and, avoiding infection is to be aware of, not touching your face, and why we're supposed to wear masks, and just there it's not even like the actions that you need to take to avoid infection are difficult. It's just, I don't know, like, staying informed is key, right? Because if we know how it's spreading, if we know why we need to wear masks, that really helps to combat like the community spread. But I feel like it's hard for me to answer that question, just because it's such like, to me, it's so simple and common sense, like, we learn things through information, and so we're blind to things if we don't know it. And I think, who was it? Emilio, I think he was mentioning how there's like a digital divide at the intersection of like a lot of different communities. This isn't in the US, because my newsletter, I try to address Black communities like throughout the world. And so I was reading this Al Jazeera article where there's talking to different healthcare workers in different African nations. And there's one medical professional working at a hospital, and I believe it was a West African nation, and they were saying how they had to learn about the symptoms and stay on top of the progression of this disease by going online. But how their colleagues, not all of their colleagues, like, had access to the internet. So like the things I think that we take, not we, but a lot of people, take for granted are things like access to information through the internet, access to accurate news sources. It's something that also feeds the inequities, right? The racial and health inequities that we're seeing, along with the healthcare inequities and environmental inequities and so many other things. But I think because the media historically has had these white gatekeepers in terms of what reporters are coming in, and who's made a reporter, but like who's made an editor, right? Because the editors are the gatekeepers in terms of like accepting certain pitches. This is why I had to do this newsletter by myself, because I would be pitching certain news stories to places, and I just always know, just from, based on trends of how my experiences, I'm like, oh, this pitch is probably not going to get accepted because this might not be for their audience, or it's going to be considered too activism-y, right? I feel like even this initiative that I'm doing right now is considered like activism-y when journalists are supposed to be considered objective. But it's like, at the end of the day, like, how objective can you be when you are a reporter or a journalist within this community, right? So, or within these communities. And so, yeah, I don't, like, who's going to interrogate the media? The media is not going to interrogate the media. There are organizations doing it, but for the most part, like, the only publications that have covered my newsletter have been Black publications, and I haven't even reached out for them to do it. Like, they saw what I was doing, And they wrote it up, right? The first person who reached out and was like, hey, can I interview you for what you're doing and get some more insight on it, was a Black woman who worked on social at the LA Times, and she has her own newsletter, right, that looks at innovation and technology and new media. And by publishing my interview on her newsletter, that's when Neiman Lab, which is this organization that focuses on like innovation within journalism, they reposted her interview, and that's sort of what got everything in motion. But it's like, we really, I don't know, I guess it speaks to just certain communities, like you can't rely on these traditional institutions, right? Like we sort of have to rely on each other and the people who are, I don't know, yeah, I would say we just need to not necessarily only rely on these traditional or historically white institutions. We need to like look elsewhere, and thank goodness for the internet and social media, because then we can see what people are really doing and working towards, like with social media and with events like this, right?
Yeah, with sorry, I wasn't sure if that was the end of it, but yeah, and it's important. I mean, social media and having access to this is kind of the thing that will help us bridge some kind of gap or make some kind of difference. It's really just getting the information. And like you said earlier, it's a common sense answer. You're like, I don't know what to say. It's a common sense answer, but it's like, why can't we get there? You know, and it's those small incremental steps that we have to take to try to do it. But I mean, it's interesting that no one's covered you except for Black publications. I'm wondering, why do you think that is? That might be a common sense answer too, but it might need to be said. But why do you think that is, and what kind of difference do you think that will make if there was that expansive coverage?
It's interesting because there have been certain journalists who are not who are white, who have crazy large reaches because they're in certain positions at certain publications. And they've like retweeted my tweet, you know, talking about the coronavirus news for Black folks newsletter that I started. Mm-hmm. And they cover media, but you know, their extent of support was like retweeting my tweet, which has the link, and then like DMing me like, this is great work. And then being like, I'm trying to think of like a way to cover this, or you know, trying to like insert, I guess, themselves into the narrative because you know, these are the things that they cover. But I'm like, when that person told me that, I was like, okay, well, maybe the best way would be to speaking to the people who are already doing this work and providing them, you know, the opportunity to get that out there on the platform that you have. Like, why do you need to come? If you weren't thinking about it already, like, it's fine. Like, yeah, so that was frustrating, but
yeah. I mean, seriously.
I think, honestly, is that journalists of color are just undervalued. Like, we're not, and I've experienced this throughout my career, where it's like, typically we'll have the more intersectional perspectives, and we'll be creating the stories that are particularly nuanced and that drive a lot of traffic, and honestly, like, make that publication unique because of that. But then, like I was saying before, we're not necessarily promoted. Like, middle management, apparently, you know, in a lot of industries, middle management is where diversity goes to die, is what that saying is, and that applies also to media. And so, you know, a lot of journalists, they get burnt out, just like the other panelists was saying about healthcare. Like, there's so many journalists of color who just like, peace out, like, I can't afford this, you know, because the digital advertising business model has, you know, really affected the media landscape. That's why all these publications are folding, and why all these journalists are getting laid off. So many journalists have gotten laid off during this pandemic. And that's not to say those were the only people left at the companies that could have been laid off. There's other people at the companies that could have been laid off, but it just speaks to, I guess, again, like, who's valued, whose contributions are valued, and are they compensated as such. So there's all of these all of these trends that we're seeing in these industries like media and healthcare and public health and all of it is just all interconnected, right?
Oh.
Yes. Jesse, did you have something to add to that?
I mean, it's just hella real. Like, and I appreciate you naming that, Patrice, and just like naming how some of these white quote unquote allies, hashtag all lies, will like come out and share the shit, but then don't actually want to like support the work. You know what I mean? That's a symbolic gesture to appease like the white guilt. But yeah, like just looking at who's actually tuned in, I can't see everyone's pictures, but disproportionately, it's mostly folks of color in here. You know what I mean? And so we'll show up for folks and support the work that we're doing and that we see. And so for the few white people that are in here, like look these folks up that are on this panel and like donate your money to them. Like help this work keep going, because a lot of us got full-time jobs. Like we're doing like a lot of this work on the side on top of full-time jobs. So like if you really, really feeling it and you really vibing with it, like put your dollars towards it.
Thank you, Jesse. Thank you. And I had something going off of what Patrice said, because with saying a lot of journalists are just like, no, there's not enough resources here. It's and kind of that kind of being ignored and not being given their coins when they need to be, basically. I have that same question for Dr. Holmes. I know working with that kind of burnout, I guess, what kind of structural parts of our healthcare system kind of made it, because I mean, physician burnout isn't something new from my understanding. So I guess what kind of has had that, what kind of structurally in our healthcare has made that a problem, and with COVID made that even more of a problem?
Big questions.
Only.
Exactly. In an hour and a half. Again, it's capitalism, but really it's managed care. So there's a great summary of kind of what happened in healthcare, the anatomy of the healthcare in the United States. In the 80s, the government thought that doctors and hospitals were going to cost too much and prices were going to go out of control. So the federal government gifted insurance companies the role of managing all the costs and assuming that they would keep them low. It also gave them zero federal oversight and no antitrust laws would apply to insurance companies. So now they're the middlemen who control all the costs, have all the cards. They have spawned middlemen of middlemen who deal with all the prices for prescriptions and everything. So the loss of autonomy is what most physicians cite as the heart of burnout. That, you know, me deciding what with my patient, you know, what the patient needs is secondary. I have to say, well, wait a minute, what will your insurance pay for? How much is that going to cost? I don't know. So just the physician is not in control of her own encounter in her own relationship with the patient. And then patients will be like, oh, my doctor dropped me. It's like, no, your doctor got dropped because your insurance company decided that the doctor who would not accept, 70% of a payment instead of 85, whatever contract the insurance company wanted with the doctor wouldn't fold to the insurance system. So then your insurance system will, you've been with one doctor for 15 years. It's like, nope, you can't see them. You have to see this other person. Then the next year, oh, never mind, you can see them again. So to me, it's unethical how patients have to change doctors every year. It's so galling. And it's so disruptive. So no one cares about the patient. It's really clear in the medical system.
Yeah.
Then the doctor doesn't matter.
Or also it would be free. That would be the first step.
Or it would be reasonable, or it would be coordinated. So again, when I think about what are the problems with healthcare, zero transparency. When I buy windows for my house or need a new roof, I could research everything about the asphalt, about the shingle, about the rating. I can, interview 3 companies, see who has the best rate. That is not possible in healthcare. You don't know what it costs, because there is no one cost. There's a cost depending on who are you, what's your insurance, what's your past medical history. So again, the loss of autonomy is hard on physicians. 86% of us are employees now. They never teach us in med school how to be good employees. So we just have no say over our life, let alone we see the system that's broken and that's hurting our patients, and we can't do a damn thing about it. And if we say something, we can have our license, our career can be ended within seconds.
Yeah.
So it's a hostile system. It really is.
Yeah. Well, thank you for doing the work to try to at least alleviate some of the things that physicians are going through.
Trying.
Really appreciate it. Yes. Carrie, did you want to hit the?
Yes. Yeah. Thank you. Thank you so much, Dr. Holmes, for sharing that. I want to touch back sort of more on this, a little bit back on more of some historical context. So this question is for Dr. Sandy Kim. Could you give us some history, something that was brought up in my channels as like the model minority myth? Could you talk about the existence of this myth? Could you talk about yellow peril? And we're seeing a lot of anti-Asian racism in this outbreak, and that's definitely something I wanted to address. So if you could talk a little bit about that, it'd be great.
Yeah, I'd be happy to. This is something I'm passionate about. So the stereotype of Asians that most people are familiar with today is that of the model minority myth. It's definitely the most dominant one in terms of mass media reproduction. Asians work hard. They're obedient. They're high achieving. They're economically successful. They're honorary whites or wannabe whites is another way you hear it. And this is a really insidious stereotype, probably because it comes across as positive. And so many Asians in America have internalized it as true. I certainly grew up believing it. I'm ashamed to say, but this is very common. But it is not true. So talking about like how the information we get, like, you know, Patrice was talking about in media, there's this like echo chamber. The same thing happens in education by what's left out. So it is not true. Asian Americans are not monolithic and represent a huge diversity of countries of origin, histories, experiences, and there's more economic inequality within the Asian American Pacific Islander community than in any racial ethnic group, statistically speaking. But it is no coincidence then, if we're thinking about what generated the model minority myth, the model minority logic, I want to call it, developed during the rise of the civil rights movement. Historically, that's the time period where it was coined, and it emphasizes, basically, the concept of the model minority tries to deny the existence of systemic racism. That's why we need to shut that narrative down, y'all, everybody. It emphasizes individual values and efforts while trivializing social problems and inequities. So the sociologist who coined this term was William Peterson back in 1967, I believe. And this was coined in a New York Times article. I mean, talking about media, right? New York Times, you think of it as this bastion of like objective news. And so he wrote an article where he contrasted the success of Japanese Americans to what he literally called other problem minorities. The model minority myth pits people of color groups against one another, uses Asians as a racial wedge, and that distracts us from how all our racializations are interlocking co-racializations that maintain the oppression of minorities and white dominance within, like I was talking about earlier, the machine of white supremacy. You can't see our racializations as separate from one another. They're integrated, they're interlocking, they work within a logic. This is why the model minority myth is really, really destructive. Now, going on to then our current moment, what we're seeing is a resurgence of a much older racialization and stereotype of Asians that never really went away, okay? And that's something people are less aware of. It's the yellow peril stereotype, peril, P-E-R-I-L, peril as in danger. The emergence of which dates back to the 1800s, when the first wave of Asian migration to the US were Chinese laborers contracted to work on the plantations after emancipation. So they were literally contracted to work to replace slaves the mines and the railroad, meaning they were contracted to also work in the mines and the railroads. So white working class folks saw them as a foreign threat, uncivilized, dirty people stealing jobs from white workers and bringing in disease and barbarism. Does this sound familiar? The yellow peril stereotype evolved over time, coming to also signify the threat of Asian world domination, as well as the dissolution of the white race through interracial mixing. And so that historically led to numerous anti-Asian policies and attacks, including lynchings, massacres, to what we all know about in World War II, the Japanese incarceration camps. And the first immigration ban ever was the Chinese Exclusion Act of 1882, which literally created the deportation and border policing systems we have today that are weaponized against Black and brown people. So the yellow peril strain of racism has never gone away. It's just that the model minority myth's amplification by mass media has served to obscure the yellow peril racialization of Asian Americans. And until now, right now with COVID-19, we see that yellow peril anti-Asian racism is as alive and well as ever, depicting Asians as a pestilence, as a virus, as dirty, as uncivilized. The rise of China, global domination. You see all of this rhetoric being amplified right now. And treating Asian Americans as unwelcome foreigners, like this equation between Asian Americans being somehow the Chinese virus, as it's called by our president. The pandemic showing us that we were never actually anyone's model minority. We were never actually anyone's model minority. It was all a facade used to strengthen white supremacy. And that's really what I hope you all take away from this webinar in terms of what you learn about Asian American histories and racialization. We are not anyone's model minority. We aren't. We never were.
Sorry. Mic drop.
That's amazing. Thank you, Sandy, for talking about that. That's something that's definitely super prevalent in my mind all the time. How, communities of color, used as tools to elevate white supremacy. And that makes me wonder, how in the world do we sort of reform that? How do we change that? And a lot of it has to do with what Patrice is saying, news media, making sure that these voices are elevated and, good and bad, thank goodness for the internet and social media where we're able to elevate these. One of these, I think one of the articles that I read recently was by John Cho, who's an actor, and he was saying that Asian American belonging is conditional. Belonging of community colors is conditional. We were talking about diversity dying in middle management. That also shows how belonging is conditional so long as, white supremacy, but as long as we have leaders who do not value people in communities of color. So thank you, Sandy. Thank you, everyone. So I guess I wanted to sort of transition into moving forward, reform. How do we bridge a lack of access to healthcare and financial/cultural barriers in healthcare? How do we move forward and how do we reform? So the first person I want to ask, and yes, Patrice saying workers are doing a great job of organizing. That's 100% true. Yes. So the next question I want to direct is at Jessie. We were sort of discussing grief right now, and that's something that we need to process in order to move forward. Could you speak on COVID-19 as sort of a collective grievance process?
Yeah, for sure. So it's the more that I've pondered and sat with this and thought on it, I feel like there's a couple things happening. We are all simultaneously in this collective grief process and in the course of living through complex trauma at the same exact time. In regards to grief, I feel like there's so many ways in which folks are experiencing loss right now, whether that's through the loss of loved ones, friends, or family. There's the loss of people's livelihood, and how that relates back to our productivity, our working, and shout out to my boy Marvin, how that connects back to all these ways in which we've internalized capitalism, that we have associated our worth with what it is that we are producing, our labor. And I think one of the biggest things is our loss of agency, and so the fact that historically folks of color, like our bodies have been restricted, and we are experiencing that right now as well. Like people are telling us when and where we can go, like how we must exit our home. And it's like, yes, this is real, and we need to do these things and look out for each other and take care of each other. And there's like a trauma piece of that, you know? And so it's hard to say like how everything is going to play out, right? Because we're still in this moment right now. And I talk about like complex trauma in, you know, in relation to like something more like PTSD. When we talk about PTSD, that's a single event, one thing that happens, and then boom, we have like this traumatic reaction to it. Complex trauma is happening over and over and over, and we are living it right now, every day, every moment. And so folks are like having the symptomology that's coming out from that, like right now as we speak, and folks are going to be dealing with it like months after we exit out of our shelter in place, you know? And so I think we really need to reframe like how we are looking after each other, how we are taking care of each other, because like through this collective trauma, like we can also experience collective healing. I like push against this idea of like self-care. I think that like in some ways, like the language of that is actually like rooted in like American individualism, which is like, you know, aligned with like white supremacy and capitalism and all that. And so it's like, we really need to engage in this collective care, this community care, that we need to be doing what we can to look out for each other. And in terms of like healing, like when we look at like Maslow's hierarchy of needs, right? Like what's on the bottom of that pyramid is like our physiological and like safety needs. So it's like shelter, food, you know, just like our basic needs, clean water, all that. And so it's like, we're not going to get to these higher levels of healing from this trauma that we're experiencing until folks have everything that they need to live. So like shout out to the Bay Area and all the folks that were turning the fuck up yesterday, you know, because it's real. Like, let's get people out of prisons. Like, let's take folks off the street and put them in homes. Let's cancel rent for the folks who are in homes and at risk of losing their homes. Let's cut off PG&E. Let's make sure everyone has food. Let's make sure everyone has access to equitable healthcare. Like, and then we can engage in this process of healing together. But until we're at that point where everyone has the basic shit that they need, it's going to be really difficult. You know what I mean?
Thank you. Yes, it's been difficult. It's going to be difficult until we're finally able to get our things. I mean, it's basically what it is. And thank you so much for telling us about all of that. I mean, it's so important to just understand what we're up against, to kind of step back and be like, okay, then how are we going to work to fix this? And being to the bare foundation of we need our things to proceed. Is a really important point to take away from that. So thank you so much, Jesse. I have a question with moving forward in healthcare. How do we move forward? And Jesse, you gave us a really good foundation with that. Another point that we had talked about earlier, and I'm just learning about, is telehealth and the possibilities of what that could mean going forward with COVID and the necessity that we've needed. I guess I'm going to direct this question first to Dr. Holmes. Could you tell us a little bit, because when I first heard about telehealth, I didn't know really what it was. Could you give us kind of a background with what telehealth is? And I know you work in it as well, on kind of what that's like.
Sure. So telemedicine or telehealth is where patients can pick up the phone at the most simple and call a service and be connected to speak with a physician. I've been doing that since I'm no longer needed in urgent care with no patients. There's no urgent care. So I've switched to telemedicine, which I'm fortunate to do. I do think it probably is the future, even though as a physician, I'm used to what we have and how it's supposed to work. But, you know, patients haven't been able to get in. This one lady's on 3 diabetes medicines. She's 30 something. She really should be on 1, but her insurance won't pay for it. So she does these 3 instead. And just being able to talk with her, refill her meds, you know, electronically, I can send the meds to the pharmacy. We talk about, you know, some tips. So it's just like, it's a really intimate connection that you can get really by phone with or without video. There are companies out there that want to do kind of like a Prime model where you pay say $20 for the year. And at any point you can pick up the phone and talk to or text a physician. So I think there are definite, and then there's mental health services that can be provided as well. So what it makes me realize is that, healthcare is such a dinosaur when it comes to, like, these things probably sound obvious to you all. You order food, you order whatever you want on your phone, but in healthcare, this is brand new. And it's really been slowed down by certain federal laws. Each state is different. Of course, big medicine doesn't really like the idea of such easy access to doctors. They want you to go through their system. So it is disruptive in many ways. But again, it's getting patient and doctor, or patient and provider, as close together as soon as possible. And again, I think it's a good thing.
Yes, and I just had a follow-up just really quick for you, Dr. Holmes. So you're finding yourself using telehealth more now, like a lot more now, or with COVID, or?
Yes, the volume by phone. So I've been signed up with telehealth for years now. I don't really enjoy it. I don't really like confrontation. So when people call in with 3 days of a stuffy nose and want an antibiotic, I don't like doing that by phone and saying no. I do like to teach and explain. I like to do that better in person. So I'm usually in urgent care, and I like to teach, and people say I spend more time with them than their concierge doctors, which I think is bad for them and their concierge. So I like the setting of face-to-face care, but most outpatient doctor's offices are closed. Patients aren't coming in. So there's no one coming in to see patients. So the existing telehealth companies that have been around for, 5 years or so, now they have a major uptick in calls. And I've spoken just this week with a lot of people who do have symptoms of COVID, and just to be able to talk them through their symptoms, and most of them, they should stay home. They don't need a test. They don't need to go in anywhere. So again, I get to talk people through a very scary time. So I think that answers your question about, so right now I'm only doing telehealth, and I'm not quite as busy as I'd like to be to pay my student loans. Again, that $160,000, but I'll find I might have to go actually work full time now, and I won't be able to do this physician project that I'm passionate about because I can't really afford to do it right now.
Well, thank you for doing the work while you're able to. And it's helping. It's real work. So thank you so much.
I guess I wanted to ask Emilio, following up to that, I'd love to know what you have to add as someone who is studying public health currently in med school. I'd love to know what you're saying.
Well, yeah, I have to agree with like a lot of the points that Dr. Holmes has mentioned, like telehealth. So in terms of telehealth in general, like just some of the advantages of it, like it has been known to improve like patient satisfaction. Like I'm sure that patient with diabetes that you were speaking about, I'm sure she felt very comfortable with you talking to her about the different meds and how you said you take the time to educate and things like that over the phone. So it has been shown to increase patient satisfaction. It has been shown to be a little more sort of outreaching in terms of access to care. And we can see that here too. And I have hopes for telehealth, because as Dr. Holmes was also mentioning, like the volume in which is being used right now is a lot higher, just because of the times specifically. But historically, this, like she was also mentioning that this is sort of brand new, right? Like historically, there has been like telehealth in place, but it just hasn't been used as much as it has been now, and that's mostly because like there is like internal structures associated with it. Like it doesn't cost as much. It's not reimbursed as high. So some clinics and some doctors choose not to use it, even though it's shown to increase these certain care quality measures for patients, which is good for them. but again, the system doesn't really have the back of some patients. But the thing a positive look into this is that because of the times and because of the social distancing measures, there has been, there's what like Dr. Holmes was mentioning, things are closing down. There's nothing else that we can do but try and reach out to these patients, and while at the same time keep social distancing measures. So clinics and doctors have found ways to incorporate telehealth into their clinics, and whereas that incentive wasn't there before, it is now. And it's my hope that maybe after the pandemic is over, we can realize how the importance of telehealth and how it can positively affect patients and keep it, and that it can help to reduce costs, especially for patients who are underinsured, which again are largely communities of color. So I just think that I have hopes for telehealth, and I hope that what we're going through emphasizes or accentuates how helpful it can be even without the pandemic.
Thank you.
Yes.
Yeah. Shai, do you want to go ahead?
Oh, yeah, I was saying the same thing. Thank you so much for elaborating on it, because I know I've never heard of telehealth before, and I didn't know that people are more happy with it, and the fact that the healthcare system kind of just doesn't do it anyway. It kind of highlights Dr. Holmes' point of why aren't we giving a shit about the patients, and why aren't we giving a shit about the physicians? I think that's really important. And I have my next question, kind of with moving forward, and how we're going to be able to change, or at least try to bandage what's happened because of COVID. I have to Dr. Kim, I had a question about your view on the Oppression Olympics, and some things we can do to kind of minimize the animosity between different racial groups. How do we eliminate this harmful rhetoric moving forward?
Yeah, I think that's really important. As I said, being anti-racist to me means, by definition, standing in solidarity with all people of color. As I was saying earlier, it means recognizing how white supremacy thrives off of the strategy of divide and conquer, pitting us against one another through a logics of race that, honestly, we all have internalized through really complex and powerful forces of socialization on all levels, coming from all institutions: media, education, healthcare, politics, religion. I grew up in a very conservative Christian home, and it happens there, it happens in the family. We are bombarded on all sides. And if we can see the bigger picture, I think that's the first step, and educating ourselves about one another's histories. When we focus only on advocating for the communities that look like us without seeing that bigger picture, we miss how all racializations are interlocking within white supremacy, as I said earlier. So anti-Asian racism right now, fighting that is just a piece of the puzzle. You cannot fully address anti-Asian racism without also addressing the violences of anti-Blackness, indigenous dispossession and their lives, neocolonial militarism, economic exploitation. Our oppressions, these are not the same, but they are bound up together in a system that's meant to keep us all down. And so our liberation is bound up together. Listen, there's hope though, right? Because we are minorities, that word, only under a white paradigm, a white lens. Under a solidarity lens, we are in fact the global majority, right? The US will be a majority minority society by 2050. But this year, 2020, is the year when the majority of Americans under the age of 17 will be minorities. Did you hear me? This year, 2020, is the year when the majority of Americans under 17 will be minorities. So that word in itself is a construct. Let's not act minor, right? That's acting minor when we play Oppression Olympics. Let's act major. That's really what I think we have to focus on.
Oh my gosh. Also just hyping you up in the chat too, because everyone's going crazy on the gems you are dropping. Yes, acting major, the solidarity aspect, and reframing our identities as and taking power towards that. is a good way to look at this moving forward. I have a question just with moving forward in general with, and I'm gonna direct this to each one of our panelists. I'll start with Patrice. But how do you see your industry or what you work in and what you're passionate about? How do you see that changing with COVID? How do you see things moving forward? And if in your specific industry, to all the panelists, in your specific industry, do you see it being able to come back from this or rebuild itself and reform? So first to Patrice, how do you see journalism has changed? How do you see how your line of work has changed?
It's interesting because I think now that the pandemic has made so many things just more apparent just for the general public, like whether it's the disproportion or the disparity with cases and deaths among different communities, or even just like a look at who these groups are who are protesting the lockdowns and the ways that they're going about it. I think so much is like I said, just becoming apparent in terms of how so many systems and institutions in our society right now are just antiquated. They're counterproductive to, progress for everyone, right? This disease has shown what a lot of the communities of color have been saying, and just like Dr. Kim said, how we're all connected, right? The fact that prisons right now have become like the #1 hotspot for this disease, and how that it doesn't just stay contained in the prison, like it leaks out to the general population. Like, I think now it's becoming very hard to challenge the fact that change needs to happen, right? And so I feel like it's a very critical and important time to sort of use this momentum, right? And to really just start organizing, because like I said, we've seen how the workers at a lot of these big like monopoly companies like Amazon, places like Instacart, all these other companies are really starting to organize and rally. And with Amazon, when the notes leaked about how they tried to smear that former employee, Chris Small, by saying, oh, he's not intelligent and he's inarticulate, like, again, one of the benefits of the internet is that these things we're able to know about them, right? And so I think, like I said, it's using this momentum to really group, to have events like the ones we're doing now. I see in the comments, the attendees are really like about that life. They're like, okay, well, that one of our panelists, how she was saying how her student loans are getting in the way of her doing this work that she wants to do that made her passionate about this field. Okay, well, like, what can we do to help like remedy that? I think it's gonna take, the collective care, like Jesse said. I love that, right? I love that. Just really interrogating the things we've learned, really start into interrogate even the language we use. Like Dr. Kim said, are we minorities? And just like Carrie was saying when this started, how she was very hesitant to use the word mainstream media because, let's call it what it is. It's like predominantly white, historically white media. We get weird saying, like we get apprehensive about saying that just because that's sort of what we've been taught, but these things are true. So I think, it's just about organizing and having conversations, even the way the two organizers of this event, this happened because they were like, yo, we have similar, concerns and issues we want to address. Like, maybe we can do something. And then that's how this panel was born. So I would say, don't discount the power you have, regardless of how many degrees you have, your resume, what your resume looks like. There's power in numbers, and just grouping together, right? Because, you know, like the saying is, we all we got. We just really have to, you know, take advantage of this momentum and push forward together. But I think it's possible. We just can't. It's you know, doubt is what really holds us back. So yeah.
Thank
I
you.
definitely want to add to that and give you an example of how, yes, we need disruptive change, especially in healthcare everywhere. But the most simple thing, the most disruptive thing that happened in healthcare in the past 5-10 years is GoodRx. I don't know if you guys know what that is. It's a startup. It's a startup. One of the guys who started eBay. So what it is that once a doctor gives you a prescription for, let's say, your lisinopril for your blood pressure, you see, okay, if it's 20 milligrams of lisinopril, you need 30 of those. You put it in the website, goodrx.com. I don't get paid by them. Wish I did.
Pay her loans, GoodRx.
Thank you. So you can put in your zip code and you can see which pharmacy has it at which price. So at Walmart, it's $4. At CVS, it's whatever. I don't want to give any numbers, but you can see which pharmacy has it for what price. This has been so disruptive in healthcare because since the 70s, studies have shown physicians want to know the price of medicine. So if I can pick which one is more affordable for my patient, I want to do that.
Mm-hmm.
So now I pull it up in the store like, oh, let's not do this one. This is too expensive. Let's do that. And for me, it's shopping. But that's so disruptive that now, you know, CVS has been sued for millions, actually $48 trillion lawsuit against CVS based on patients. That was SEC claim. But anyway, patients can see and ask their pharmacist, hey, this would have cost me $3 with a coupon, but you charged me $10. So this revealed, I looked into this in the master's program I'm doing, but there's a system set up by insurance companies and their middlemen, the pharmacy benefit managers, that they set the price as $10 for a prescription, knowing that $3 is $2 is what's needed for it. CVS gets Kroger gets $1. The other $7 goes back to the pharmacy benefit manager, and that's just passive income for them. So anyway, this whole scheme was revealed by a simple startup that said, okay, the 3 companies that control 80% of the drug market, prescription drug market in the US, forget about them. If you just ask any other company, hey, what pharmacy has this medicine for what price? It's easy. But that was brand new, 2010. We've been using it probably since 13 or so. But this kind of blew open the price of medicines. And again, it's relatively simple. So healthcare is so old and so broken, it doesn't take much, in my view, to kind of crack it open and make some changes. And I hope you guys can help do that.
Yes. Thank you. And I wasn't sure, I just wanted to, are you able to stay for the Q&A or?
Yeah, I can stay. I have my telemedicine open. I'm good.
Okay, cool. Okay. And if you do need to, please feel free. We won't hold you from helping all those people. So are we starting with Carrie, did you want to start with
I guess in the interest of time, we're going to start our Q&A.
Yes.
We got a lot of really great questions in that Q&A form. So do you want me to just kick it off? I'll start with the insight questions.
Yeah.
Okay, so I have a question, I think, from Aisha. And I think this is to every panelist. What are your thoughts on the white culture protests happening around COVID-19?
Dr. Holmes.
just holding his
Yo, man, fuck all that noise. Just straight up. I don't know what else to say. It's just really pointing out the disparity in terms of who are the police here to serve. We were under no assumption that they were here to serve us, but this is another example of that. Just all that mess, we don't need any of that energy.
Yeah. Cool. Does anyone want to add that? I can move on to the next question.
I think we all have that feeling. Yeah. Fuck that mess. I think fuck that mess was that simple answer that we all needed. That's
hashtag.
Perfectly. Someone quote that in the chat. We're gonna have to take away.
Love that. Next question is from, account is Common Simple Beautiful. What is the most effective way to check on my own community when they're wrong? It's coming from an Asian American person. I think that's what they said.
And was that directed at a
Anybody? Sorry, anybody who'd want to answer. Like, what is a good way? I think what they're asking is, you know, to check and have conversations in our own communities when they express like anti-Blackness, different sorts of racist rhetoric. How do we check in with our own communities?
You know, the first thing I want to say is don't be afraid to speak up. I think because that's the hardest part is, especially if it's in your own family or it's in your community, it can be hard to confront someone when they're saying something that's anti-Black, or in other communities if they're saying something anti-Asian. And so, yeah, I think we need to start practicing that muscle a bit. Depending on what kind of culture you come from, there are certain Asian cultures that where, you know, talking back to elders is really, really frowned upon. So I think we would, you know, the people who are part of those kinds of cultural communities, like how can we strategize and come up with ways to speak to our elders without them feeling like we're disrespecting them, and yet still understand the value of education around the kind of education you won't get through mass media or the education system in this country. That's on us, right? Because the system is not built to hear our voices, to hear our histories. So it's on us to actually learn those histories and then to communicate them with our networks. Because if we're all doing that, again, we're going to be a majority minority society. That will actually lead collectively to a shift. That's what I believe, like a larger shift in discourse and culture and ultimately systems, hopefully.
I have a follow-up to that question, I guess kind of the inverse, if anyone would like to speak on how in the Black community we can get rid of anti-Asian mess. How do we get that? How do we self-check ourselves? Because I've seen on social media kind of like this back and forth with the Asian community and the Black community, and it's not okay on either side. And the Black community is terrible when it comes to that, especially when the virus first started. We were not the best. So does anyone have kind of ways that the Black community and the Latinx community, the Latino community, other communities can be checking ourselves?
Yeah. Shai, do you want to move to the next question, or do you have a?
Oh, I was kind of posing that. Yeah.
Yeah, I could try. I guess in terms of Latinx communities, I feel like it's difficult because, like we were talking about, it's about years of this ingrained implicit bias towards other races, and that have been ingrained into the way we think. I feel like it's important, at least it's in a way to start, correct? Is important to maybe talk to people within your community. Like I'm assuming, I'm just gonna say Latinx communities. I'm Dominican, and this is what my family does. But there are certain things that we do. There are certain like language we use automatically, to that conveys this sort of anti other race or anti-Asian race. I'm just gonna say, for example, like a lot of in Spanish, a lot of like Latinx individuals use the word chinito to like describe all Asian, when there's like it's these things that and people just say that like talking, and it's like they just overlook the word, and it's part of the language. But it's important to first realize, okay, I have these internal biases. Where do I show them? And then think about, okay, I use these specific words to describe certain populations. Maybe I could stop from doing that, and like sort of chip apart all these little portions of yourself that you see are expressive of implicit bias and things that have been integrated from like a discriminatory sense. I think starting with yourself and thinking about how you can stop this sort of anti-racist sort of language and thinking, I feel like it's important to recognize. And in the Latinx community, I feel like language is something that is just thrown out there. So I feel like it's important to recognize it in yourself first before we can keep going. That's what I would say.
Yeah, appreciate that, Emilio. Like, that's hella real. Like, the work starts at home. You know what I mean? And I think like we gotta look at our own identities and like the bodies and beings that we occupy, and thinking about like what privileges do we hold in the world, and what does that mean in terms of like having more of a responsibility to speak out on these things, right? Because anytime we're talking about oppression, it's usually the folks that are most impacted that are the most vocal. You know what I mean? And so it's like we as folks in positions of privilege, like outside of race, like thinking about like gender, sexuality, ability, every aspect of identity, like me as like a cis het man, non-Black person of color, like I have to take all that privilege and utilize that for something for good, you know? And so I think about like, you know, in engaging folks in these conversations, whether it's family or friends or colleagues or whatever it is, like we look at like the difference between calling folks out and calling folks in. Like a lot of what is associated with calling folks out is like, you know, communicating shame, which instantly like shuts the conversation down, puts folks into a space of defensiveness. But we also have to acknowledge that not everyone is ready to receive that information, and that it's actually like wearing on our souls to try and invest so much time in trying to change someone's mind who is not ready to learn. Like, let's put that energy towards like the 9 other people that are ready to learn, as opposed to this one. You know, and when folks get hit with that defensiveness, like tell them take that shit to therapy and like holla at me, you know?
Yes.
Did you wanna, I could do some questions from the submitted ones?
Yes. And then also another call. We are taking questions only from the submissions and from Instagram, and we're trying to do on a first come first serve basis, being mindful of time. So yeah, you can go ahead, Shai.
Oh, okay, wait. So based on what she sent me, which one's the bottom and which one's the top? So I don't go out of order.
If
like,
you go to responses.
I'm there.
And then start from the
Is
top.
in terms, the one that starts with in terms, is that the first one? Okay, we've kind of addressed that.
Let's do the next one.
Okay, so this is a question for anyone. It's not directed at anyone in particular. I'm interested to learn more about the mental health system being conditioned to oppress certain racial groups. So if anyone has something to speak on that.
I wanted to, I
Nice.
can't speak specifically to mental health, but the book that Jesse mentioned is Medical Apartheid. Look how thick it is. It's 400 pages of stuff.
Hit me with the question one more time, Shai.
All right, I'm interested, I guess just interested in learning more about the mental health system being conditioned to oppress certain racial groups.
Yeah, I mean, I don't know. Like, I wish I could give like a concise space where I feel like all that information is collected. I would just, you know, I mean, the reality is like, it is like a Eurocentric practice, right? And so like the entire like founding fathers of like American psychology, like all of that is like grounded in like whiteness, and like everything that comes along with that is that bias. And I mean, there's examples throughout histories in which like the, you know, mental health system has been like utilized as a tool to like oppress trans folks, been utilized as a tool to oppress women, been utilized as a tool to oppress folks of color. Thinking about like right now, right? Like I work primarily with like young people of color. And I can't even tell you how many times I've had like a young Black or brown boy come across that has like a diagnosis of like oppositional defiance disorder, which like, if you just break it down at its core as a diagnosis, is like, they just ain't trying to listen to you. You know what I mean? And so when you think about like, okay, where are these diagnoses coming from? When we look at therapy, it's predominantly white women that run the field. So we have white people giving young Black and brown children these diagnoses that they are defiant. You know, to reframe that, I look at that as like they're engaging in acts of resistance, but that is a tool that's used to oppress them. You know, the lifehood of like oppositional defiance disorder usually turns into conduct disorder. When you look at the diagnosis of folks that are incarcerated, a lot of times it's conduct disorder. Like that is one of the primary diagnoses that folks in prison have. So when you give a young Black or brown person like this diagnosis of oppositional defiance, we are setting them on a path that we are saying we are going to put them in prison because they do not, you know, listen to the rules, or they do not occupy by like the expectations that are being put on them, but not recognizing that like all of that is inherently biased and racist, and that is why they're engaging in these acts of resistance.
Yeah, if I could just add to that, from the perspective of someone who really values therapy and has benefited from therapy myself, I have an anecdote. My husband and I went to marriage therapy for a very short while with a white male therapist, and I fired him when after like 5 sessions. Okay, you all know me like for an hour, right? He said, you know, I know you're very passive and submissive, but you need to speak up in your relationship. I'm like, do you see how that is not me? No. That is not me, what? Everybody. Like, and he's not listening. He's functioning from a place of a stereotype of an Asian woman. So I appreciate Jesse's comments because a lot of it has to do with, again, just like media, just like education, there's like the majority of therapists are white. And that's a problem. We need to change that. And so what did I do? I found a woman of color therapist. She changed my life. She was amazing. And she even let me graduate. She's like, you're good, you know, like I'm here if you need me. But she's like, you know, we can stop seeing each other. In the capitalist system, she said that to me. Like, that's trust. Like, I have that trust for her now forever. And I'm constantly recommending that therapist to my friends to the point where she couldn't take any more clients, right? So.
That's beautiful. Oh my gosh. Yeah, it's so important. I mean, having access to healthcare and being able to knowing how important it is, like it's life-changing. And especially when we're talking about the systems in place right now, being able to find like that humanity in these things is so important.
Yeah. So this is another question. I think, can you talk about the lack of preventative healthcare measures in our communities as well, importance of nutrition, fitness, food access? I'd like to direct this to Emilio and Dr. Holmes because we sort of talked about this before, especially Emilio.
Yeah, no problem. So in terms of the relationship between food access, so the concept of food deserts, right? It's like, it's these places where healthy food options and related things are difficult to access, either based on a geographical sort of reach, as in there's no supermarkets anywhere near me, and I cannot, like, it's difficult for me to get to that place, source of food venue, or like in many cases, costs. When I make a certain income and I'm responsible to feed my family, am I gonna take a healthy food that costs like $13-15, or am I gonna get like a whole meal that can effectively serve like everybody in my family for $5 when it's much more unhealthy? It's like the choice is pretty obvious in those settings, and these are basically food deserts. A lot of these places that have difficult to access fresh produce have large community residents that are predominantly ethnic and minority communities. And so in terms of COVID-19 and how like this has been impacting those communities, it's like the social distancing, we've been told to stock up on food and wait it out for however long, because staying at home is safer. But then if you have already difficult access without COVID-19, if you have already a difficult time accessing food stores, how can we expect people of this community to abide by those stay-at-home orders? It's unrealistic, and it puts those communities at risk. Now, in terms of costs, communities within food deserts also suffer when it comes to the pandemic, because so like social distancing has been like a lot of people they have their hours that employees have been cut, their small businesses have been closing down, and these people have a diminished to almost no means of income, and so we need more money, because now the family unit is at home, and we need more food, and we need to stock up, but then there's less money, and now it's an issue, and it's a problem. What makes me happy is that there's been a lot of responses to this. I want to just say the community east of LA has been doing a lot of response to this. YMCA, USC, and White Memorial Adventist have been getting together to put in food distribution, and honestly, you can help. You can look it up and you'll see it there, but people have been responding to these issues. They have a program where they take food over to elderly individuals within the community of east of LA, which is predominantly Latinx community. And so that people who are elderly and immune compromised don't need to get out of their houses and risk themselves getting this virus. They have people deliver, and you can get involved by delivering, packaging, and if you are in a situation where you yourself cannot put yourself at risk because you live with a family unit or there's elderly in your individual homes, there's also ways to get involved virtually. But yes, food and this pandemic has been hit pretty hard, especially like in my neighboring communities, and it's important right now.
Thank you. Oh, yes.
Sorry.
No, please.
I want to speak generally about preventive care. The way our system is set up is an open system, in the sense that an insurance company, it's not financially in their best interest to pay for a mammogram. It's not. Because you have one insurance, one insurance this year, it changes the next. So your insurance company today to pay $600 for a mammogram, it's not in their best interest, because they know by the time, if you get cancer years later, it's going to be 5, 10, 20 years down the road. So preventive medicine doesn't save money in the US. In closed systems like Canada or anywhere in Europe, where one system pays the price of those cancer bills and those cancer medicines, they know what they're saving down the road. So they're going to pay for whatever prevention now. So it's just a fundamental thing I want people to understand about the healthcare system, that again, it's about what is it costing, not the patient experience.
Yeah. And that's where capitalism comes back in. But yes, but thank you for adding on to that. I have a question, a submitted question. It says, how did you deal or approach the topics of race, mental health, or racism / white supremacy in academia? And how do you manage that? I'm not sure, this isn't directed to anyone in particular, so anyone who has a response to that, feel free. I could also repeat the question, just because I feel like, yeah. All right. How do you deal or approach the topics of race, mental health, or racism / white supremacy in academia? How do you manage that? Going once, going twice.
I mean, I can just give like anecdotal like experience from like being in graduate school and whatnot. I've lived in the Bay Area my whole life. I went to graduate school at Boston College, and I was not prepared for the ways in which that like racism shows up in like a neoliberal space like Boston, especially coming from the Bay where shit is just hella radical. And so I think the things that helped me were finding community. Like melanated social work was birthed out of a brotherhood between me, Michael, Marvin, and Josh. We all met in that grad school program together, and that was when we formed the Roots of Melanated Social Work. I could not have gotten through that grad school program if I did not have folks like that were holding me through that process. Especially when you're in this classroom and you're the only person of color in a classroom of 30, like you're looking for folks to be like, some shit goes down, like who's gonna have my back in here?
Real talk.
And I think just like I had to get comfortable with just like leaning into the discomfort and like just intentionally making people uncomfortable, because a lot of times, like, shout out to my professor, I seen her she was viewing earlier, Betty Blythe. That was like one of like the few like dope ass white folks at my grad school. But like outside of her, like most of the people in the program were not gonna push like racism and talk about like how that intersects with like the mental health piece, or even bring in any type of liberation framework. So it came to like the students a lot of times to really insert that. And so, but I think it's necessary because folks need to know about that. I think we really just need to look at academia and making sure that we are compensating, particularly students of color, adequately, because there's so much that they capitalize off of. Like, they are exploiting like our knowledge, our lived experience by having us in that classroom. And a lot of times we are bringing so much to that experience for all of our white counterparts. And so we need to be compensated appropriately for that.
Mm-hmm. Yeah. Okay, we just have like 1 or 2 more questions left, just in the interest of time, so we can sign off at 3. So my next question is a media-related question. So it's basically saying, what are communities of color, people of color doing to help fight anti-Asian rhetoric or to help address anti-Asian hate crimes? Yeah.
Did you say it was media related?
Yeah, media or like information sharing related, like what can we do to fight racist rhetoric? And I think the asker specifically wanted to touch on like how communities of color can like support each other. Yeah, and that's sort of a combination of 2 questions.
I think also, just to add, I guess, to the question, well, not add to the question, but I think that also, specifically though with the anti-Asian rhetoric, it's been like violent, and it's been like it's a different, or I can't speak on if it's how it's changed, but from what I'm seeing in the media, it's different than I've ever seen before. Yeah. So I guess dealing with that too, with this new, it's not new, it's a different showing of it, but this anti-Asian thought and rhetoric.
Yeah.
If people are looking for maybe more information on this topic, or looking for individuals or organizations who speak to this topic, I mean, me, myself, as a journalist, whenever I'm trying to find something, I literally start off just by Googling. Don't underestimate, the fact that you're probably not the only one who has this concern. And usually a lot of these things have been addressed, whether it's through like an op-ed article, or a lot of times through like grassroots or independent blogs. Just obviously take everything with a grain of salt. Do research into the source of the information you're getting, but honestly, start off. Look at what organizations like Carrie's organizations, look at what they're doing on Instagram. Look at like who they're following. You'll start to see a lot of networks when you start to look at the people who are doing the work you want to do. When you look at who they're working with, right? And I would say that's maybe like a good starting place.
If I could add on that, something I've just always kind of tried to do, and I think the first time I had heard it was in one of my comm classes in college, is to be active in your news consumption. Look for Asian perspectives, look at Asian articles, articles written by Asian people. Like, you need to be reading their perspectives. Don't be reading some white guy talking about, oh yeah, people there's anti-Asianness around, but yeah, we can see that, but what do we do to fix it? What are the nuances of it? Like, we need to be, and Googling it, just like as basically as Patrice said, like Googling it, what's going on, what's happening, because ignorance is also just not knowing, and then you're unknowingly complacent and continuing it. So just being active and searching out this knowledge and looking for ways to better yourself, and taking Asian experiences and perspectives and believing them. That's a huge way to combat anti-Asian rhetoric.
Yeah, I'm looking in the comments and saying there's not much out there, and I think that comes with a lack of like support, like of uplifting specific ways. Like, yes, it's one thing to go and look for it, but it's also another thing, as mentioned before, I think, with bringing it into the traditional like media or like the more popular media lenses. Like, just when I look at like different algorithms, like with my Apple News, I just purchased, like, it's really difficult to have those like, sorts of voices elevated, especially when there's that barrier of executive leadership of these media companies coming from a place that doesn't understand and whatnot. Let's just do one last question, just in the interest of time. What are everyone's final hot takes? Thank you, Shai.
Yeah, I just submitted that question. I was like, we might have to wrap it up. So. But yeah, those final hot takeaways. I guess we could go down the line. I guess starting with Jesse.
So, I appreciate just like the opportunity to come together here on this panel, to hold space here with y'all, to build and connect and hear about all the dope and amazing work that everyone here is doing. I think this is a jump off point for like folks that want to get involved, like tap in with all these folks' organizations, follow the work that they're doing, support it, to stay plugged in. But, I just want to appreciate the folks that tapped in, all the followers of Melanated social work, because that is like, all the folks that are supporting me right now, that is like what is holding me and keeping me going. And so I appreciate y'all for creating this space. And I think the more that we just continue to engage in dialogue and build together, like we gonna get through this, y'all.
Thank you, Jesse.
Yeah.
Dr. Sandy.
Takeaway, I just like to emphasize the role of education. Obviously, I'm an educator, and unless we know about ourselves and our histories, and then also other people and their histories, there's no way to have true dialogue, actually, because we are bringing in unconscious biases that white supremacy has conditioned us with. So the education is important, and something I'd love for everybody to just have some homework to do is look into the history of Black and Asian solidarity and organizing. That history has been invisibilized. And so there's this rhetoric that gets perpetuated that Asians are not political, Asian Americans don't care about people of color. That's a part of the model minority myth. And so looking into that history, finding ways in our different spheres to amplify that is really important, I think, because it's a counter narrative to the anti-Asian racism that's happening, the model minority myth. But it also shows how, again, our liberation is bound together. And so that's, I think, just one thing I want to close with. But thank you so much for this conversation. It was really wonderful.
Yes, and thank you for partaking in it and making it so wonderful. We really appreciate having you on the panel.
I'd like to piggyback off of Dr. Kim. I like that B major. I like that a lot. I just think that none of us should underestimate our experience and what we can do, because I mean, it's small things and small people who do make big changes. And I do believe that. And as bad and as messed up as big systems are, each of us has a role, whether it's showing kindness in your sphere, helping. I like that collective care. It's my new favorite type of care. But like each of us in our own sphere can do our part and to like push the envelope a little bit further. And I do believe in that. So let's be major together.
Yes.
Yeah, and really quick, I would say just, co-signing all of that in terms of don't undervalue yourself and what you can bring to the table. We all have different unique experiences. And that those are our strengths, right? And also, like I said before, Carrie and Shai, the way they just linked up, said we want this panel to happen. Have you guys ever done something like this before?
It's our first time. We're thinking about doing more because we love this.
See, right, in the comments, people are saying this is the best panel I've been to. I'm not even a panel person. So don't underestimate what you can bring to the table. And also, like what Jesse said, don't undervalue yourself, right? Someone in the comment was saying, they wanted information on how to approach publications about potentially writing about things. I would say negotiation is big, because I think Jesse's also talking about don't let yourself get exploited by these institutions that are going to take the value that your perspective and experiences bring. Just keep those things in mind. But there's a lot of power that we have, and that's coming to light right now during this crisis and pandemic.
Yeah. I guess some beautiful things have been said. I also feel very fortunate to be part of this panel. And like, I can't iterate it enough. Yeah, do not undervalue what your experience has to offer. We are part of our communities. I know that a lot of the people who are attending here are obviously care about these issues, and they want to learn something more about it. They want to know what they can do to help. And often, from what we talked about with mistrust and communities of color, the people who these communities listen to are members of that community, family, friends, neighbors, whatever. It's not people who are most valued and whose opinions are most valued within these communities that usually don't have MDs, PhDs. They are people who are leaders within their community. And that's what I feel that all of you are, because you're here for this message, for these messages, and to learn. So I would encourage you to be a voice in your community, and get what understand the things that you learned, look them up, study them, like a lot we were mentioning, and then be a voice and share it within your communities, because you are often the voice who's going to be listened to the most, as opposed to outsiders or anything like that. So that's my takeaway for that.
Thank you. And I also have another takeaway, I guess. I mean, if I could do a takeaway really quick.
Do it. A little sign just so that everyone knows how to connect. But
oh yes,
keep talking.
Okay, cool. Just going off of what everyone has been saying about not undervaluing yourself. I have this passion for mental health, though I can't be on one of these panels, because what I would say, it wouldn't probably make sense. I'd probably ramble. I'm not a doctorate. Just little things like that. But just the passion that's there, being able to find, okay, so how could I facilitate? How can I help that? And taking that in just as a thing for everyone, and every person who has helped be on this panel, whether it's me or Carrie asking the questions, whether it's the panelists, whether it's Kat, the transcriber or transcriptionist, I'm not sure which one's the correct one, but she's doing what she can to make this possible and make this accessible to other people, and accessibility to this knowledge, and having the ability to do it, being able to do this for free. Like it's really a beautiful thing, and to be able to do it either way you can. And it just started with a Zoom call between me and Carrie. I had some LaCroix in there, and we were really just talking and finding out what we were passionate about and what we wanted to do. And then that's how this idea came to be. And to have all of you guys that listened to it, and to our panelists, again, thank you so much for talking and sharing each of your individual experiences, because the wealth of knowledge that you guys hold individually, and as a collective, it's unstoppable. And think about that on a larger scale, and hopefully that we'll be able to push through this. And I don't know, it's very hopeful. I'm feeling a little hopeful.
I'm feeling hopeful.
and I'm really happy that we were able to do this.
Yeah. Do any panelists have anything to add? I do want to wrap up, just in the interest of everyone's time.
No, just final thanks to Carrie and Shai for all of your work and how you put this all together. You guys are pretty amazing. Thank you.
Thank you.
Well, Thanks, everybody. We are just about to wrap up. What I have up on the screen are social media accounts. Please, panelists, let me know if I missed any. But they are all here. You can follow us on social. I think that's a really good way to connect. Following this, I do have all of your emails. So I will send you a newsletter sort of summarizing this information. We've recorded this conversation. Fingers crossed it worked. That will be distributed later this week as well. Some of the unaddressed questions I will also put and send in a compilation email to our panelists should they want to answer, and then put those answers in the newsletter. So please look out for that in the coming week. Just, you know, it may take a little bit of time to thoroughly compile all the information here. Shout out to Shai, shout out to Carmen, shout out to Sandra, shout out to Patrice, shout out to Emilio, shout out to Jesse, shout out to Kat, shout out to everybody for coming through here. This has been so great. Thank you all for taking the time to be here. We are trying to host more panels down in the future. So please keep on the lookout for that. Follow our social media for the most updated news. Yes, Patrice's coronavirus news for Black folks at SpeakPatrice. Great. Awesome. So I'll keep the room open for a little bit as we all trickle out if you want to share some news in the group chat. But yeah, I feel like a YouTuber.
Yeah, I was like, comment, subscribe. Someone said that, like, comment, subscribe.
Thumbs up.
Yeah.
Bye, guys. Thank you.
Bye. Thank you so much.
Bye.
Thank you. Have a good one.
Appreciate it, y'all. Take care.
Yeah.
Thanks,
Take care.
everyone. Bye.
So me and Carrie, you want to just do that thing where we talk out and then the music plays?
Oh, yeah, the music, the imaginary.
And then it pans out. Wow, shout out to my parents for staying the whole time. So cute.
Yes. Oh my gosh.
Yeah, get those socials, everyone. Woo!
Socials.
For those remaining.
To unmute and come chat with us. That's
yeah,
cool.
Chat. Hey, Dad, I see you. You're looking to unmute. It looks like you're trying to do that. Looks like that's what you're trying to do. Look at it. Look at it.
Yeah, shout out Shai's parents. I love it.
Shout out everyone.
I love this.
Yeah, okay. I don't know if we can talk about this, but I definitely want to do another one.
Yes. What is just?
And education in prison. Well, one separately, but that's what I want to do.
Yes, we're trying.
And then ableism. Yeah, that was a good one too.
The criminal justice system. What were we talking about? What did you say?
Oh, criminal justice. Yeah. So the criminal justice. Should we do? Would it be too much to combine criminal justice and prison reform?
I mean,
is that under the same thing?
Oh, Jesse. Ooh. Yes.
Oh, if people are still listening. Oh yeah. So what would you guys like to hear about in our next panel? Like, comment, subscribe.
Oh, sorry.
We were thinking about doing one on education.
You do a podcast? Shai.
Oh! We might, once we can be in the same, I guess we don't even have to be in the same place.
Thank you, Laura, and thank you for DMing us beforehand. Anti-Asian bias work, it's definitely something I want to do, particularly with the Asian Mental Health Project. Let's do that. I'm thinking of actually hosting This Will Cost. So if y'all are still here, please donate with our link trees. Doing anti-bias,
I need to do that.
Like sort of offering that free for people. That might be something later down the line, just because it requires like a specific counselor. Prison abolition, restorative justice. Here for the podcast.
Yes.
Great. Yes. Yeah. Thank y'all so much for being here still.
Yeah.
Hi, Shai's family.
Can they hear? Are you listening? Are they listening? Nope, they're just looking. Merm, Dad, can you hear me? Unmute yourself. Carrie wants to meet you.
I want to say hi. I like the SC hat. We
did it. Well, it's a bad hair day, Carrie.
Oh, me too. I can't see the back of my neck, but it's full of sweat. So
I actually minimized the sweat. I'm my nervous sweats. I thought I would be a little more nervous up here, but it felt good. The vibe was good. Jesse broke the ice, I think.
Jesse,
you guys were so great. I am so proud of both of you.
Oh, thank you. Oh, you can hang up.
Oh yeah, you can hang up. We're just chatting now. We're just staying until.
You said it says
well,
leave.
We like to try and be young.
No. We're talking to the people in the chat.
I know.
But yes, thank you guys for coming. I'm doing. You know.
Bye, Connie. Thank you, Laura.
I'm thinking about, so me and Carrie were talking about doing an educational one, and I was thinking of asking Sydney to be on it. My sister she was a principal, but she quit because she stopped being a principal because of the like